Hey everyone, welcome back to another video. In today's video, we're going to be talking about a common injury that many people will have experienced, wrist pain. If you have ever had discomfort or pain in your wrist or are currently experiencing pain in your wrist, this video will be helpful for you. We'll be breaking down the anatomy, what some of the common causes are, and my tips on how to manage and recover from a wrist injury. Our wrists are intricate joints that play a crucial role in daily activities, from typing on the keyboard to lifting up objects. Due to their constant use, they're susceptible to various issues that can lead to pain and discomfort. Understanding the anatomy of the wrist is important in managing any injuries that may occur in the area. So, the wrist is made up of multiple bones and joints, which allow for a great deal of movement. Let's have a look at what these bones are now. You can see here that there are the bones from the forearm, the radius here and the ulna on this side. The radius is on the thumb side of the forearm and the ulna is on the pinky side of the forearm. They come up and form a joint along with the carpal bones right here. And for the carpal bones, we have quite a few. You've got scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, and trapezium. From there, it actually forms into the bones of the hand, which are the metacarpal bones here, and then each finger and their associated phalange. And as you can see, because there are so many joints that form up the wrist, it is one of the most mobile parts of the body. Commonly, the wrist can do flexion, extension, rotations, which are called supination and pronation, and also movements called radial deviation and ulnar deviation. These movements are produced by the muscles and tendons of the wrist, which run up into the forearm and into the elbow. Due to the way the muscles connect from the wrist to the forearm and the elbow, we commonly have to treat those muscles of the forearm and elbow in order to help with any wrist injuries. And this will become more evident as we go through different ways to manage your wrist pain. A wrist pain can have multiple causes. It can result from overuse, repetitive movements, or sudden injuries. There are also multiple specific conditions that can cause wrist pain, such as carpal tunnel syndrome, de Quervain's Tenosynovitis, an injury to the TFCC, just to name a few. And management will look very different for each one. We won't be able to go into detail on each specific condition in this video, but if there is one that you would like more information on that I don't cover in this video, please leave me a comment down below. I'll be going through some of the general principles when dealing with wrist pain and talking about some of the common issues that we see. So let's take a closer look at some of those common conditions associated with wrist pain. Many of us spend a lot of our time in front of computers for work and for leisure, and wrist pain is known to affect those of us who type for a living. This can present as simply pain around the wrist from repetitive use, also known as a repetitive strain injury, or RSI for short, or it can lead to tendonitis, which is inflammation of the tendons around the wrist. This can happen in a non-office setting as well. For example, it can affect people who play sports that require a lot of wrist movement and strength, such as badminton or tennis or rock climbing. So, what can you do for an overuse injury resulting in wrist pain or tendonitis? The key factor in management is to identify the source of the injury, or in other words, what activity is it that is causing you to be injured? This is often the first step and one that I spend quite a lot of time on working out with my patients because injuries don't just happen for no reason. I'll go through some of the common examples of the things that I would look for when thinking about this. First, has anything changed around the time that your wrist started to hurt? This might be the amount of work that you've had to do, more overtime, a change of your computer setup, increased time working from home on a non-optimal setup, or a return to or increase in sports that require a lot of wrist and hand strength. This list is obviously not exhaustive, but it does cover some of the common ways in which an overuse injury might occur. If you have been suffering from wrist pain, you might be able to identify one or two of these examples in your own story. In saying this, it is definitely helpful to get assessed by a healthcare professional and get their help in working out what has caused your injury, as everyone is different and everyone's circumstance is different. But once you have identified a potential cause, it's time to work out how to change it. In regards to work ergonomics, the common issue that I've seen is where the keyboard and mouse are slightly too far or too high from the person's lap space. The most comfortable position for the wrist and hands are to rest in your lap space with your elbows bent at around 90 degrees. You might find that this is an issue if you work from home and don't have a second monitor or a plug-in keyboard to use, and you've propped up your laptop to achieve the correct height of your screen for your eyes. This lends to the hands having to reach further than optimal, and over time, this can result in an injury. If your main contributing factor to wrist pain is that you have had a sudden increase in sports, then you might need to practice relative rest. For example, if you have been exercising 1 to 2 times per week, and you have suddenly increased this to 5 times per week, which has resulted in your wrist pain developing, you might need to drop that back down to 2 or 3 times a week to gradually let your wrist and hand muscles develop and strengthen along with your use. We'll be talking about some ways to strengthen your wrists later in the video, so stick around for that. Overuse can also lead to tendonitis, as mentioned before, and one of the most common conditions around the wrist is de Quervain's Tenosynovitis, which is an inflammation of the tendons of the thumb. It usually results in pain in the base of the thumb, and it can also travel to the radial side of the wrist. The two main tendons that this condition affects are the abductor pollicis longus and the extensor pollicis brevis. This usually causes pain with actions such as turning a doorknob, moving the thumb, forming a fist, or lifting objects with your thumb pointed up to the ceiling. It's also very common in pregnancy and young parents due to the carrying and holding of their newborn babies. Another common cause of wrist pain is to fall on an outstretched hand, or fush for short. This is common in sports that often require diving or falling. In severe cases, it can lead to fractures of the carpal bones, such as the scaphoid fracture, which is notoriously easy to miss, as it can often present as a very bad sprain of the wrist. So if you have taken a fall, it is prudent to seek medical help. Scaphoid fractures can often present with severe tenderness and pain when pushing on the radial snuff box. In less severe cases, you may have just sprained your wrist, which will recover with rest and treatment by a physiotherapist. In addition to treatment, they may start you on some wrist exercises for mobility and gradually strength. Now let's look at some of the ways to manage wrist pain and then some strengthening exercises for the wrist. One of the initial steps of managing wrist pain is to rest, as I've mentioned earlier before, and to apply ice to reduce any inflammation. Resting would mean avoiding any aggravating activities, and ice should be applied 15 to 20 minutes each day. This is particularly useful for conditions such as de Quervain's due to the inflammatory nature of it. You will want to apply the ice on top of the area of pain, and my tip would be to use a frozen bag of peas rather than an ice pack, as it can mold better around your wrist. Sometimes it is also helpful to use a wrist brace, tape, or splint to help stabilize, support, or immobilize the wrist to allow for adequate rest, especially if the activities that are aggravating the wrist are just activities of daily living. For de Quervain's, it is commonly suggested to use a thumb brace, as the thumb movements are the problematic ones. Bracing will help reduce the strain on the wrist and allow for it to heal even if you have to use it every day. Stretching and strengthening exercises are also very useful to help improve wrist mobility and strength. Two very useful stretches would be the wrist flexor and wrist extensor stretches. I'll put into the video a demonstration of how to perform these. And as I mentioned before, the wrist muscles come all the way up the forearm and into the elbow. And so as you do them, you should feel the tension following the line of your forearm. These stretches are very similar in how they are performed, with the only difference being the orientation of your hand. You'll want to hold each stretch for 30 seconds, and you can perform this 4 or 5 times a day. Now, let's take a look at some of the strengthening exercises you can do for your wrist. Firstly, you will want to train your wrist extensors, as they are commonly weaker than the wrist flexors due to the amount of time we spend typing and using our flexors day to day already. To do this, take a light weight, maybe half or 1 kilo, and rest your forearm on your knee with your wrist hanging off it. You can also use an armrest or table if it's at a suitable height. While holding the weight, drop your wrist down and then lift it back up until the point of pain, and then lower again. You'll want to repeat this action 10 times for 3 sets. As a general rule, you'll want to train your affected side to at least match the strength of your unaffected side. You can also work on wrist stability by holding a weight and performing an exercise known as hammer curls. This looks like a bicep curl, with the main difference being the orientation of your hand so that your thumb is pointing up towards the ceiling when you bend it up. This will bias the muscles of your forearm and require you to stabilize your wrist against gravity and the weight during the exercise. Start with a small weight and gradually increase as you get stronger. Again, you're looking to do 3 sets of 10. The next exercise involves strengthening your grip, and the easiest way to do this while you're injured is to use a clean kitchen sponge or a soft stress ball for resistance. Hold one of the items in your hand and gently squeeze. If you feel pain, stop and let go of your grip. You'll want to perform this with little to no pain if possible, again looking to do 3 sets of 10. Additionally, you can train your finger extensors by using a rubber band and looping that around your fingers. Open up your fingers against the resistance of the band and then close them again. This is a great way to train the finger-specific muscles and for conditions such as de Quervain's Tenosynovitis. Now you can moderate the difficulty of this exercise by selecting a thicker or thinner or shorter or longer rubber band. As always, you should aim to perform all of these exercises with little to no pain, and if you are in pain, it might be a sign that the activity or exercise is too difficult for you currently. If your wrist pain persists or worsens, it's crucial to seek professional help. A healthcare provider or physiotherapist can perform a comprehensive assessment and recommend specific treatments that are tailored to you and what you need. That concludes our video today on understanding and managing your wrist pain. Remember, each person's experience of wrist pain is unique, and it's essential to listen to your body. The information and exercises shown in this video will be a great starting point to help you on your road to recovery. If the information in this video has been helpful to you, please hit that like button and subscribe to stay up to date with more tips on how to look after your body. Thank you so much for watching, and I'll see you in the next video.